I spoke to Dr. Jessi Gold, a psychiatrist in St. Louis, and I asked her if we're just getting complacent.
I think at the beginning, people were like, I can do anything for a month, and a month feels like a doable amount of time. I can be in my house, I can deal with it. I can push off the thing that I want to do for a month. But now we're in like infinite territory where people just keep kind of saying, oh no, it's going to be a year or it's going to be 2 years and we don't know. And that's scary for people because unknown is really where all of our anxiety and uncertainty comes from. And when we don't like uncertainty and unknown, we sort of get really anxious and we get this energy which is like it needs to go somewhere.
Is there a way for us to put this sort of nervous energy into constructive human interactions that don't necessarily mean bringing 100 people to a wedding?
Yeah, I mean, I think, it's sort of like re-spicing up the relationship and finding other ways to still get excited about something. And maybe that right now is like advocacy. Maybe that is something that we're excited about. Maybe our mental health needs some work and we can spend some time on us. I think one of the good things about the pandemic is you can say, I do a lot of things and I don't know why I'm doing all of those things. Do I like any of those things? And you can spend some time being like, what are the things that I actually like and what do I want to be doing? You can spend some time doing that. Nervous energy can also be spent exercising. That's really good for your mind. I think you could spend that energy on like going for a run, going for a bike ride, going for a walk in a mask with a friend. Those kind of things are really good use of that, like, help me, I need to get out, please let me get out energy.
What about the long-term impact here? I mean, you talked about sort of reevaluating your life and what am I spending my time doing, but in months and years, when we look back on those months we spent in isolation, those months we spent not going to restaurants or only going to patios, seems like a small thing, but enough of that, I imagine, sort of adds up to have some sort of impact down the road.
Yeah, I mean, I think I'd be remiss to say this isn't going to affect our mental health. I'm seeing it in patients. I think at the beginning, people were like, how do I just function? How do I do the basic needs of my like Maslow lower hierarchy of needs, food, safety, water, family, just kind of sticking there. The longer it goes on, the more you go, oh, wait, I'm sad. Oh, wait, I'm anxious. Oh, wait, I miss people. And the longer that happens, the more you start going, I need help. And that's okay. That's why we're here, people like me. But it's also something to notice about yourself because this is a hard thing. And I think I'm seeing a rise in people coming to see me. I think it's going to just keep happening. I think there's a lot of hard things that come with winter. I also think there's the election. There's a lot coming up that's just kind of hard on our mental health, so we have to be aware, be prepared, be aware that like the energy that we're feeling is maybe not just anxious energy, but things that we need to like think about how to cope with in the long term and think about what that's doing and how to take care of ourselves.
You mentioned those things that are coming up, I mean, I imagine you would agree with the idea to get yourself prepared and have someone to talk to before it gets really bad with winter and the stress of the election, etc.
Yeah, I've been telling all of my patients if you can get connected with a therapist now, if that's something that you're considering, because I sort of see it like there's going to be a mad rush flood to them because, I mean, there are so many things coming up and it's sort of like, thinking of what to do in preparation for what could happen.
I know I'm doing my research now. I hope other people are too. Dr. Jessi Gold, it's a treat to talk to you. Thank you so much for helping us understand what's going on here.
Absolutely. Thanks for having me.